All right, welcome back to the Elias Macko Show. A new study shows that if you take Viagra, it could cut your risk of Alzheimer's by 60%. Turns out the drug, which is mostly used for erectile dysfunction, actually blocks an enzyme found in the brains of those who suffer from the disease. The blue little pill of happiness helps increase your blood supply, which is linked to improving your brain health. And it could also help to treat dementia. Let's find out more on this. Dr. Christopher Labos, cardiologist, degree in epidemiology, and you hear him on Sundays at 8:10 with his house call with Ken Connors. Hi, Dr. Labos. Welcome back to the show.
Hello.
So listen, I think if you are in the media and you have to make a headline, this story, Viagra could stop Alzheimer's, my goodness, click, everyone's going to click. So let's get beyond the clicks and let's get to the nitty-gritty of this study. Tell us the details. Tell our listeners what they need to know.
Okay, so first off, we should explain to people what we mean by dementia and what Viagra actually does, because even that is a little bit more complex than people realize. Everybody associates Viagra with erectile dysfunction. What I think a lot of people don't realize is that it was initially developed as a blood pressure pill. It's just, not that effective at treating blood pressure, and we have better alternatives out there. But it still is used to treat a variety of cardiac conditions, primarily, pulmonary hypertension when the pressure gets very high in the lungs. So it does have effects beyond just erectile dysfunction. Its main job is to improve blood flow, and it does that by blocking a particular enzyme called phosphodiesterase 5. So the fact that it could be used for other things is not completely outside of the realm of possibility. But perhaps the most important thing is to realize is that when we say the word dementia, we don't necessarily mean Alzheimer's disease, even though we tend to use the terms interchangeably, because dementia is a general term to explain the problems with memory that occur at an older age. Alzheimer's disease is one of the things that can cause dementia, but there's a lot of other things that can contribute to dementia, and one of the big ones is also cardiovascular disease. People who have what's called vascular dementia or ischemic dementia. These are people that suffer sort of mini strokes over the course of their entire lifetime, and that deficit can build up with time. So if Viagra is having any impact on dementia, one assumes that its main impact is going to be on improving people's cardiovascular health and improving their blood pressure, improving the blood flow, maybe having an impact in that way.
Now, whenever I read a story about a study, sometimes you look into the details and then you find out that what the headline says only applies to mice in a laboratory. And then you're like, okay, so it doesn't apply to us. Now, can you tell us about how this study was done and how seriously you're taking it?
Yeah, so this was a what's called a cohort study. So they didn't actually experiment on people with Viagra. They didn't take a group of people and give them Viagra. What they did was they searched electronic health records. And why the researchers were excited about this study is that this was the first time using a new electronic database that they had in the U.S. So they wanted to prove that the database was viable as a research tool, which I suppose they did. But what they basically do is they search through computerized records, and they search for people who take Viagra, match them to people who don't, and they use the statistical technique where you try to match people as closely as possible, so make sure that people are the same age, that they have the same, medical problems, and then compare the ones who got Viagra to the ones who don't, and then look to see if these people are less likely to develop dementia over time, which is a perfectly valid form of research. The problem is, fundamentally, the people who got prescribed Viagra are going to be different than the people who didn't, even if you can adjust for as many of these variables as possible, because there's always some variables that you miss. So there's always the potential for confounding when you have this type of non-randomized studies. They're perfectly valid studies, but they are not definitive. If you wanted to prove the point, you would have to do a randomized trial. Just that those are very expensive and very time-consuming, and research like this, where you can mine people's electronic health records, it's less definitive, but it is easier. And sometimes, people like to do these types of studies because they are helpful if you're looking to explore and trying to generate new ideas. But they are far from definitive, and I'm certainly not going to start taking Viagra regularly just to prevent dementia. I'm not sure we've proven that point quite yet.
We're with Dr. Christopher Labos talking about this study that shows an apparent link of cutting your risk of Alzheimer's by taking Viagra. But Dr. Labos, this could also show a whole bunch of other things, right? This is the risk of looking at this headline and then saying, well, I should take this drug, because this could also indicate people that have a lot of sex are less likely to get dementia, right? That's what it could be here too. Maybe it's people who have more sex show a decreased risk. Could it also be other causes?
Yeah, and it could just be highlighting people who are more proactive about their health. A lot of people are sort of, complacent about things. They may have issues. They may not go and seek out problems, whereas people who are more proactive are going to go and get their prescriptions filled. So you may be identifying something as straightforward as that. This was a big issue if we, go back to the past with hormone replacement therapy. Go back to before the year 2000. A lot of people thought hormone replacement therapy for women was going to prevent heart disease and stroke and all that. And when the actual studies were done where they tested people against the placebo, they found that no, it didn't. And in fact, it was simply a consequence of the fact that the women seeking out hormone replacement therapy were being more proactive about their health and were generally healthier on average, despite the many attempts to adjust for these differences statistically. So I think we need to have a healthy dose of caution for these types of non-randomized studies, because they are not definitive. They can be suggestive and they can be interesting, but they shouldn't in and of themselves be something that's going to change behavior, especially when it comes to a medication that's actually quite expensive. If anybody's ever had to go and buy Viagra, because it's not covered by Medicare and not covered by many private insurance companies, it is a very expensive medication. And so as a therapy to prevent Alzheimer's disease, it wouldn't be cost effective even if it were actually true.
And just to wrap up here, since you brought up women here, obviously women don't take erectile dysfunction drugs. Can anything be learned? You mentioned the databases they're looking at. We know that dementia can be prevalent among women as well. What about that aspect? Can we learn a little bit more, especially looking at databases and that kind of thing, with a group of the population that doesn't take Viagra, I guess, as much as men?
Well, and this is the advantage of having large databases like this, and this is why sometimes we are in all of the Scandinavian countries where they have these large centralized countrywide databases where they can look for associations like this. And it's a little bit difficult to do this in Canada because our data is fragmented across each province, and getting data sharing agreements between the provinces is a real logistical challenge. So these types of databases are important. They are very valuable for research, especially when you want to look for rare side effects of medications and stuff like that. So they have a role. They just aren't necessarily useful for being causative. But, if you want to go looking for things, one of the first key steps is to do this type of computer research, because it's easy. It doesn't impact patient care. It doesn't require that much money, relatively speaking. It's important. But you have to invest in having these databases, have them accessible, have them secure so people can't hack them, and make it easy for researchers to be able to access them when they have a valid question. But that takes infrastructure and support and money and maintenance. And, we're pretty good in this country, but it would be nicer if we could share the data across all of our provinces just to give us even more data sets rather than being as limited as we actually are.
Dr. Labos, thanks for helping us go beyond the headline. I appreciate it.
My pleasure. Take care.
That's Dr. Christopher Labos right there.